Right. Well, hello there, everybody.
Hey, everybody. Hello, hello. Welcome to Healthy Habits, Healthy Life. We're Will and Faith Scott. We get to the root, health and wellness. But this is Healthy Habits, Healthy Life. This is where we come and we talk about how your choices can create your habits, and your habits will develop and create your lifestyle. Yes. So this evening, we got a very, very, very good presentation for you this evening. So thank you so much for joining us. Take your time out to join us this evening. We never take for granted when you come in, but hey, we want to bring you the top-notch, best information that we can gather. And tonight, I guarantee you, you're going to be totally satisfied with this wonderful, wonderful guest presenter that we have this evening. So Queen going to go on and take it over for a little while, and we'll get back with you in a second.
All right. And again, if it is your first time joining us, thank you. If it is your 100th time joining us, thank you. Okay. But before we get into the nitty gritty of our presentation tonight and our guest speaker, we do want to make a very special announcement. I don't know if y'all heard through the grapevine or not, but there is an amazing, powerful, inspiring, educational, scientific-based online summit that's going to be free. Yes. That's going to take place on February the 12th. Let me show my screen here.
Just a couple days from now.
Hold on 1 second.
Yep, there we go.
Yes. On July the 12th.
No, February 12th.
I'm sorry.
Hey, I want some July weather myself, but actually it's February the 12th, not July. Don't do it on July the 12th.
Oh my goodness.
July the 12th, you're going to miss it.
Look, y'all, it's been a long day. That's my birth month, July. But February the 12th, in about 2 or 3 days.
That's right.
This summit will be kicking off. There's going to be over 40 experts, medical doctors, nutritionists, educating us on the real truth about weight loss.
That's right.
And they're gonna have some amazing testimonials. Will and I, we're so humble. We will be one of the guest testimonials on this summit. But please sign up, click on the link above or below, wherever you're watching this at, YouTube or Facebook. I think YouTube is down below, Facebook is up above. But click on the link so you can get registered, and don't miss this upcoming summit.
Don't want to miss it.
That's February the 12th.
That's right. That's right.
Now, tonight's topic is going to empower you.
Yes,
all right. And we have a very special guest, one of my favorite plant-based doctors on the show tonight, Dr. Kim Scheuer. And if I'm messing your name up, Dr. Kim, you can correct me on the screen. But Dr. Kim is board certified in family practice and lifestyle medicine.
That's right.
She is conversant in Spanish and American Sign Language, y'all. She can talk with anybody, right? And she is licensed to see patients in over 20 states. Okay, that is totally amazing.
It is.
Talking about leveling the playing field, right? We have access to Dr. Kim.
That's right.
She practices telemedicine and plant-based telehealth, started Doc's Lifestyle Medicine, and has facilitated complete health improvement program, the CHIP program courses. Dr. Kim not only encourages her patients to eat plants and to live a healthy lifestyle, but she too live what she preaches.
Practice.
Okay,
that's
that's the kind of doctor I want to listen to and follow. Dr. Kim lives and benefits from the lifestyle she recommends for her patients. She loves to share what she has learned with all who want to be healthier and happier. Today, I'm so honored to have her with us, and she will be talking about the benefits of nutrition for recovery. So everyone, please welcome, Dr. Kim.
Hey, everybody.
Hey.
Yes, it's so. I'm sorry. Hold on, I'm trying to work this stuff here, Dr. Kim. Hold on, y'all. With me now. Hold on. All right, let's hide this. Okay, let's put Dr. Kim. How you doing, Dr. Kim?
Great. So I'm going to talk for like a half an hour, and then I'll have some time for questions and things. The way it's working, I can't figure out how to hear you guys during when I'm talking. So keep your questions. I'm happy to answer everything at the end. And because of the way it's working, they're going to have to change the slides for me. So I'll have to tell them to.
Well, since we neither one of us are techies, right? We're going to work this thing together, and just know that when you get the floor, we can hear and we can see you. Okay?
Okay.
All right. So let's go ahead on and get the slide up here showing the screen. We're going to have Will and Faye.
All right. So I'm going to talk about nutrition to optimize recovery. So we're going to go to the next slide. And hopefully, oops. Yay. So what is recovery? Yeah, that's much better, where you can see me better. So recovery is a return to normal state of health, mind, or strength. It's repairing tissues from either exercise, surgery, illness, or as we age, our tissues get damaged. So that's why it's important that we have recovery and know how to recover and what nutrition will help. Next slide. So who needs it? Everyone. Doesn't matter, you're old, you're young, keep going. It's important for the general population because recovery lowers inflammation. Oh my gosh, you can't see the slides. And it improves, hold on. It improves blood flow, which is important for the prevention and treatment of chronic diseases. It's also important for if you have infections, injuries, or surgeries. It's important for athletes because the faster you recover, the faster you can get back to training harder and longer. And so it's important for all of those. Next slide. So how do we improve from recovery? Well, basically things we need to do is reduce stress, get enough sleep, because when we're stressed, we have more damage. When we sleep, we repair. We want to reduce inflammation because inflammation causes pain and stuff and damage. We want to improve blood flow so we can get more oxygen and nutrients to the area. We want to repair oxidative stress, and we want to improve to alkalize an acidic environment, because acidic environments can really cause problems. And actually, the foods in this standard American diet are very highly acid forming. So we want to change that so we can recover. Next slide. So the statistics are 48 million people a year have surgery in this country. That's a lot of recovery needed. But the best way to recover from surgery is to avoid it in the first place. So we've got to avoid damage. So recovery before you have surgery is important, but also once you have surgery, we want to maximize our recovery. And unfortunately, most Americans are overfed and undernourished, which doesn't help. Next slide. So it's interesting. We don't think of things like rotator cuff injuries as a diet-related things, but rotator cuffs are a result of age-related tears. And I'm not talking about age as old. I'm talking about age as advanced glycation end products. And there's been plenty of studies out there that show that these proteins or lipids that are from advanced glycation end products cause damage, and they cause damage and cause things like rotator cuff damage and things like that. And the foods highest in AGEs are meats, cheeses, butters, margarine, mayonnaise, highly processed foods, and fried foods, a lot of the standard American diet. So you want to avoid those so you don't even have the rotator cuff injury, so you don't have to have surgery. And then there's now a new strong correlation between heart disease and rotator cuff injury, because it's the same thing. It's the inflammation causes heart disease, can also cause rotator cuff damage. Back pain, next slide, sorry, next slide. Back pain, we used to, I don't know if you guys heard, but erectile dysfunction is called the canary in the coal mine for coronary artery disease, meaning if you have erectile dysfunction, that's the first sign of heart disease. Well, there's also a relationship between back pain and cholesterol and heart disease. So there's studies like in a Japanese population that the higher the bad cholesterol, the more back pain, and there's more disc degeneration with back pain and with bad diets. And so that's because the vessels going to the back have cholesterol in them, just like the cholesterol in the heart. So the blood doesn't flow and you get more damage. And so again, we don't think about the need for recovery in terms of back pain and prevention of back pain and other things like that. Next slide. So it's also a big thing in knee issues. So there's a big difference between arthritis and arthrosis. We're a country of arthritis, and arthritis is an inflammatory condition. Well, as we get older, we have arthrosis. We all have damage. I have a lot of damage in my knees from skiing and activity and stuff. But I don't have pain because I don't have the inflammation. So there's lots of studies that show the association with fats, cholesterols, and triglycerides in your blood and inflammation in joints. And then there's also problems with surgeries that 1 in 5 people undergoing surgery are unsatisfied with the outcome. And then for some people, there's actually the risk of dying after a surgery. So again, why we want to recover our tissues before we have to have injury, illness, and surgery. This is what we're talking about and why it's very important. Next slide. So, like I said, we should start thinking about recovery on day 1 and throughout our lives. Before we're ill, before we exercise, before we have surgery, but even then, after those things. If we haven't started to think about our nutrition and recovery, we need to do it as soon as we get ill and things like that. And there's a lot of research out now that COVID, the healthier you are, the more nutritious the diet, the less likely you are to be really sick if you get exposed to COVID. So again, we want to think about recovery before we get sick. Next slide. So again, how do we do it? We fuel our bodies well with high quality, nutrient dense, alkaline forming, easily digestible, high antioxidant foods, fruits, vegetables, etc. We hydrate. Cells need hydration to recover. We get sleep. When we have sleep, it improves our melatonin, which improves our repair of cells and improves brain function. We get enough natural light. It's important to get vitamin D, but there is some other research out there that the sun not only makes the vitamin D better, but there's also other things that the sun does much deeper and that improve serotonin, improve physical recovery, etc. There's some good information out there about that and COVID also. And we want to decrease stress from nutritional stress, environmental stress, physical stress, psychological stress, and you want to keep moving. Activity affects everything, including aging, weight, chronic disease, endocrine system, and digestion. And we do not want to put in toxins in our bodies like smoking. So no smoking. Next slide. So the basics of nutrition and recovery are fueling our body with health promoting foods and avoiding harmful foods. So the plant-based foods that are health promoting are fiber, lignans, flavonoids, carotenoids, vitamins, etc. And you can see that animal products have much more inflammatory stuff, whereas plant products have less inflammatory stuff. Plants contain about significantly more antioxidants than animals. So that's one of the important reasons for plants, because we want those health promoting anti-inflammatory foods. Next slide. So dietary components that affect inflammation negatively are mTOR, TMAO, IGF-1, heme iron, arachidonic acid. Those are all in high in animal products and processed foods. The ones that positively affect us are phytochemicals that increase DNA repair, decrease inflammation, and decrease oxidative stress. And there's this one slide that Dr. Christina Miller shared with me shows that the more meat, fowl, fish, eggs, dairy, processed foods, the more arachidonic acid, the more highly inflammatory foods. And we take meds like corticosteroids or NSAID, non-steroidals like ibuprofen to block all the stuff that those things cause. The best dietary per the Dietary Inflammatory Index, fiber is the least inflammatory component, while saturated fats, which are in animals, are the most inflammatory component of foods. Next slide. So this is a lot of information, and I'll answer questions later, but we got a lot to talk about. So for recovery, you want to make sure that the endothelium, which is these cells in the middle, in the vessels, which help you vasodilate, bring healthy oxygen to your bloods, we need to maximize those. And you do that with nitric oxide. And so that healthy lifestyle includes exercise, so you can get that, the antioxidant rich foods, a diet rich in fresh vegetables and fruits, which improve endothelial function, refined sugars, so saturated fats, alcohol, salts, fast foods, oils, they all damage the endothelium and don't help the nitric oxide. And remember, I was talking about shoulder surgeries and before. There's studies that show that increasing nitric oxide increases wound healing from tendon injury. So you want to increase the foods that increase your nitric oxide, like arugula, rhubarb, cilantro, butterleaf, spring greens, basil, beets, beet greens. Never throw out your beet greens. Love them. Swiss chard, oak, and things like that. Next slide. So we want to fuel our bodies for sure with, the macronutrients we need. We need good proteins. We need good carbohydrates. We need healthy fats to increase our omega-3 and 6 ratio. We need water. I consider water as important as anything else because that's how you get the water-soluble vitamins that you absorb, like B1, 2, 3, 5, 6, and 12. And you do need some fats to help absorb fat-soluble vitamins like KAD and E. And you need minerals, but in the amount that's in healthy foods, not that you don't want to add extra sodium. You don't want to add extra stuff. You don't want to take supplements to add it. You want to eat it in your food. Next slide. So specific foods to aid, whoops, did we go to the next slide? Yes, specific foods are berries, lots of fruits. So berries, they have a lot of vitamin C and rebuild collagen, and pomegranates and grapes are also helpful. Vegetables, like green leafy vegetables to increase your nitric oxide for blood flow and to bring all those vitamins in. Healthy fats like nuts and seeds and avocados in an appropriate amount can help the absorption of the fat-soluble vitamins you need. Vitamin E in nuts helps wounds heal faster and reduces severity of scars. You need beans like tofu, lentils, peas, and other beans high in protein and iron, which will help healing from damaged tissues after surgery. Whole grains, when your energy is depleted after surgery or with exercise, those replenish your energy stores. Spices like turmeric has been great for decreasing pain, fatigue after surgery, and also for inflammation. Probiotic foods like fermented foods like sauerkraut, kimchi will help your gut, and tempeh is another one. Helps your gut deal with, like if you're having surgery, anesthesia, antibiotics, painkillers, etc. And water, hydration, and don't forget the fiber, because if you have surgeries or if you're on chronic pain meds, you have constipation from narcotics and things, and fiber is really important. So you want to maximize your diet to decrease risk of infection, falls, pneumonia, etc., and increase your mobility after your surgery. Next slide. So this one talks about some of the vitamins you need, and this is all in foods: vitamin C, zinc, A, and K. And you can see they all help for your immune system, help your tissues, help with clotting. Minerals like calcium to help your muscle strength and bone healing. Again, not supplemented, but in the foods. Iron for red blood cells, such as in spinach, soy, lentils, cashews. And if you want to increase the absorption, you add some citric fruits, like you have this big salad with some little oranges on it or things like that. Magnesium for sleep, and mussels, which are found in nuts, seeds, and avocados. Next slide. So things to avoid after surgery and injury would be sugars, added sugars, like foods and drinks, like sugary drinks are not good for you, sodas and things. They give extra calories without nutrition. The bacteria feed off of those, so you have a risk of infection that's higher. Highly processed foods cause insulin spikes, which affect your ability to heal. Animal products, like we talked about with the inflammation and impair healing after surgery. Alcohol, a big one, impairs immunity, leaves you more susceptible to infection, decreases your ability to clot, to heal, so you have much higher risk of bleeding and swelling, and it can affect your pain negatively after surgery or after injury. So next slide. And for recovery for athletes, again, you want to avoid most supplements. They're not usually regulated. They often have harmful contaminants, and vitamins and minerals need to work in conjunction with others. So if you separate out like beta carotene, then it actually causes damage rather than repair. And so you want to keep the beta carotene in your carrots. And there's been tons of studies on that. You want to avoid a lot of the commercial sports nutrition products because they have artificial flavors, they have refined carbohydrates, they have denatured proteins and harmful fats. Protein powders can put stress on kidneys. So it's rare that I ever suggest anybody has a protein powder. You can get plenty from your foods. And you want to decrease your insulin resistance and insulin spikes. And many of the protein powders out there are made from whey, which is actually an animal product, which increases IGF-1, insulin-like growth factor 1, which increases inflammation and cancer. So you got to try and avoid that stuff. Animal products containing dairy and especially processed meats, again, hit all those inflammatory things. And oils. And processed food has a lot of oils, increases immunosuppression, which we don't want. Next slide. Oops, I think we talked about that. Okay, so some beneficial things. You definitely want vitamin D, whether it's from the sun or if you're low, make sure you get that. B12, sometimes we have to supplement that, whether you eat animal products or not. Iodine, you want to make sure you have plenty in your diet if you're plant-based, because you can get that from seaweed or some supplement. DHA and EPA are algae-based omega-3s, or just eating lots of flax seeds and chia seeds and some walnuts will help. Turmeric and curcumin, remember we talked about that. It's anti-inflammatory. Zinc, jury's out on this. Better to get from your food. Mushrooms, better to get from mushrooms, but you can also do mushroom extracts, and green teas are really great. But there are green tea supplements out there. I would suggest you drink it rather than do the supplements because you don't know what's in them. Next slide. So overall, dietary options for recovery. Again, we want to eliminate inflammatory foods. We want to eliminate processed foods, oils, animals, and we want to add tons of fruits, vegetables, legumes, grains, nuts, and seeds. Hydrate with plenty of water. Get your flax seeds in for your omega-3s, and make sure you're getting enough calories. You want to eat your G-bombs, which is greens, beans, onions, mushrooms, berries, and seeds, and tea, which is tomatoes, if you can. They help with recovery. And sprouting legumes and seeds concentrates nutrients, so they actually make them even better sources. So like sprouted broccoli seeds are great. The next one. And so where do you get more information? There's lots of information from these websites. So about recovery from surgery. Things that I do suggest is not fasting before surgery, just like you wouldn't fast before a marathon. You want to carb load before surgery and carb load before a marathon as much as you can. Obviously, you have to fast overnight because you don't want the anesthesia. You don't want to vomit if you're being intubated. But before that, carb load and eat plenty of highly nutrient dense foods before surgery and after surgery. Very important. And then there's some more information here. You can look for more of that about how to avoid undernourishment and hypernourish yourself for recovery and how to prove that. And those are some good websites. Next one. And for athletes, there's some books out there. There's some movies out there. There's some websites out there. There's all kinds of issues about, how to get information about the appropriate nutrition, like chronometer, things like that. There was a very good debate between James Wilkes, who wrote the Game Changers, had an amazing debate on Joe Rogan where he talked all of the science of recovery. And if you haven't seen the Game Changers, do. I got a couple more quick slides of some recipes. So the next one that I like, this is a recovery drink with lots of bananas, berries, pineapples, hemp seeds, beetroots, flax seeds, and greens all in a thing. And I make this after a big, if I'm going to do a big workout, or even in preparing for my COVID shot, I had some recovery drinks beforehand, and that was really helpful. Next slide. Dr. Juan has a really good YouTube lecture on recovery, and here's one of his things. So if you look on whole food plant-based nutrition, there's a great lecture on it. He has to recover every day because he's in the OR with a lot of radiation. So he puts all of this into a smoothie to protect him from the radiation that his cells have to recover from every day at work. And the last slide is just more information about, whoops, that didn't work out well. You can go to plantbasedtelehealth.com to find out more about me and ask about that. But that is it for my lecture, and I'm love to hear some of the questions and things like that.
Showing strength.
Awesome.
Okay, we're back. That was awesome information, Dr. Kim.
Oh
Let me see. Let me show your contact information. Let me get this right here. That way, I'm going to hide this just for a moment. Showing the screen. So that's Dr. Kim's contact information.
Yes.
And again, I'm going to try to arrange that where you guys can see that. Dr. Kim, I'm going to hide us out just for a minute, and you can go over your contact information again. 1 second.
Okay. I don't know if anybody can, that's my information. You can find me at plantbasedtelehealth.com or Doc's Lifestyle Medicine. And then I'm happy to answer some questions. I did see some questions in the comments. And so one of them was, how do you get some zinc, B12, or vitamin D in plant-based foods? Okay.
Yes.
So that's a really good question. So zinc you can find in beans and nuts. Those are some good places for zinc. All right. B12 is really hard to find in foods unless it's supplemented. And so what's interesting is animals, we used to get B12 from the ground. Okay. It's in the ground. It's these microbiomes or micro things in the ground. And so we used to drink our river water. We used to eat carrots and just pull it out of the ground and eat it and not wash it off. So it's hard to find. And even now they are supplementing animals with B12 so that way you can get it from the animals. We don't want that. So B12 is something that I would supplement. You can get it from nutritional yeast, but probably not enough. So one thing you can do is get your B12 level checked to see if you really need it. And that's also another thing for vitamin D. But if you don't need it, don't supplement it. If you do, you should supplement. Now, vitamin D in plant-based foods, there are some, just like in regular milks and cow's milks and things like that, they supplement that with vitamin D. You can find that in some of the plant-based milks. If you don't do the plant-based milks or you make your own like I do, being out in the sun really makes a difference. But unless you're living on the equator and have a loincloth on, you're probably not getting enough on a regular basis, especially in winter when we're all covered up. Right. So getting your vitamin D level checked and then doing a little supplementing of that may be helpful too.
Awesome.
I think that was that. Somebody okay.
See, how do you sprout broccoli seeds?
Wow. I love sprouting my broccoli seeds. So there is a YouTube video on it, and I think it's not Dr. Juan. It may be Dr. Juan that has the thing on sprouting broccoli seeds. But what you do is you get broccoli seeds, at the grocery store or something like that, and they're pretty cheap. And I take a tablespoon and I put it in a jar that I just put the top on. And I use a mesh top, but you could also use any kind of top that will let you turn it over, let the water come out. And so I put the jar, so I put like a tablespoon of broccoli seeds in the jar, put it down with water overnight. Then in the morning, I rinse out that water, I add more water, and I tip it upside down, because you want to tip it and let the water come out the next day, not the first night, but the next day. And shake it up and tip it down. You want to shake it so the seeds are all around the glass. Okay, there's a really good video on how to sprout. Love it. Yeah, so Dr. Juan has a great video. Then you do that twice a day for about 7 days, and all of a sudden this stuff grows in there, and it's awesome. And so you're gonna, and twice a day, rinse it, shake it up, let it drain. Rinse it, shake it up, let it drain. And after about 6-7 days, it fills up so hard it's hard to get out. But check out Dr. Juan's video. It's amazing. And it's delicious.
Wow.
Yes.
Wow. Do we have any questions for her?
Yeah, I do.
Okay. All right. Hold on 1 second, Dr. Kim. Let's see. All right.
So I have a question, Dr. Kim. For athletes like us, okay, is there a certain time frame or lapse in time after exercise, or is there a certain time we need to wait after exercise before we start our recovery process with the nutrition, with the food?
With the food. It's a really good question. People vary on that one. I actually eat pretty quickly after I exercise. So I'll go out in the morning, exercise, then I'll come out back and I'll have some food.
Okay.
You can let your body cool down.
Okay.
And so I but I just eat right away. I don't know what, to be honest, is the best for super athletes.
Right.
There are some websites out there.
Okay.
But interestingly enough, for diabetics, you want to actually eat, then exercise.
Oh, okay.
Because exercise is like a back door for insulin. You don't need insulin to get the sugar into the cells.
Okay.
So you eat and you're diabetic, and then you exercise right away, like for 15, 20 minutes, 30 minutes after you eat. Your sugar goes into your cells without using insulin.
Oh, wow.
So it helps your insulin sensitivity, and it helps you need to use less insulin. So it's really interesting that way.
Yes.
Wow.
Oh, that's awesome. The reason I was asking, I'm sorry. The reason I was asking that, because typically when we exercise, I break my fast not until around 11 or 12 o'clock. So I didn't know if it would be better for me to eat something prior to that. Okay. Great.
No, I actually break my fast after I exercise too.
Okay.
And so for me, that works really well. But you and I, we have already carb loaded.
Yes.
So we have a lot of energy in our cells.
Okay.
For other people who don't eat healthfully, they don't have the energy in their cells, and they bonk. But when you eat healthfully, you don't bonk. You keep your sugar levels pretty regular, and that's why we can do that. So eating healthy first,
yes,
as a practice, will make your exercise. Like, I don't feel like I have to eat after I exercise at all.
I don't either. I was just wondering, because sometimes it's 1 o'clock. I may exercise early in the morning, but I don't really get hungry until 11:30, 12, 1 o'clock.
And that's fine. So we do a lot of our repair when we're starving. So, that's why. So we do a lot of repair when we sleep over, and that's why you want to have that time of not eating.
Okay.
Because you're doing repair at that time.
Well, alrighty then. Okay, that's
my pearl for the day.
That's right. So we have another question here. Let's see. Let me hide us there. Put Dr. Kim on solo.
And blues. So you have plantar fasciitis, and for people who don't know what that is, I'm not going to put my feet up, but if you take your foot, pick it up, and press on the heel, and you have severe pain, and it's hard to walk, like especially when you get up in the morning, That can be plantar fasciitis, and that's an inflammation in the plantar fascia, which connects from your foot, the heel, to your Achilles tendon. So a couple of things for plantar fasciitis is at night, use a Strasbourg sock. So a sock that you put on and it ties here, so your foot's like this, so you're stretching out your Achilles. And whoops, sorry, I wrote something down. So that helps, but also inflammation. That's inflammation. So yes, these tips will be helpful to heal from plantar fasciitis because you want the most anti-inflammatory diet. So turmeric will help. When you use turmeric, like if you're adding it to your smoothie, put a little of black pepper in there because that really gets the anti-inflammatory components, the curcumin of the turmeric, to activate even better. So just a tiny bit of pepper with the turmeric in your smoothie will help. So yes, these will help. Plantar fasciitis is tough. It takes a long time. So stretching exercises, sleeping with the Strasbourg sock, those things can help. Sometimes acupuncture can help too. But the anti-inflammatory diet, perfect.
Awesome.
Good.
Wow.
Let me get myself back in there. Wait a minute. Hold on a second, Dr. Kim.
No worries.
All right. Okay. Yes. Yay. I know. We have another question from Ann. Okay. All right. Let's get us off the screen here. Dr. Kim.
Yeah.
What is the daily goal for eating legumes?
All right. So if you don't know about Dr. Greger's Daily Dozen app, which you can get on your phone, it's free. It has lots of information on there. And all you have to do is see for legumes on there, it's beans. They suggest 3 servings per day. And that's either a quarter cup of hummus or a half a cup of cooked beans or lentils, tofu tempeh, or 1 cup of fresh peas or sprouted lentils. And they have all kinds of information about what it actually is. I would get Dr. Greger's Daily Dozen on your phone, click, and if you look at the side, I'm sorry if you can't see this really well, if you click here, it tells you exactly what you need and how much. So about three doses, 3 servings.
Awesome.
All right.
Wow, that is great.
Well, wait a minute. I think okay. I don't know if this is a question or a comment, but I know prior to going whole food plant-based, I used to have to eat all the time. Felt I needed breakfast, lunch, dinner. And the longer I've been plant-based, I find that I eat less. Sometimes I eat twice, sometimes once a day, especially if I get a big, huge salad and I'm good, so that's okay, right? Is that because I'm, eating very nutrient-dense food and my body is getting what it needs? I'm not going to say I don't stress eat sometimes, especially now during tax season, but I try to stress eat on healthy foods. Like if I want something sweet, I'm eating cherries or grapes or, fruit or something like that. But I do find that now, 7 years in being plant-based, that I eat less food, and I was just wondering, is that because it's just our bodies is getting what it need? And of course,
two things. One is before you were bigger, you needed more.
That's right.
Now you're not bigger, so you don't need as much. But before you were eating tons of high calorie, low nutrients foods, so your body, despite having the calories, was like, I need nutrients.
Right.
So you want to eat more and more and more. Now you're having the high nutrient, low calorie foods. Your body has what it needs, and it tells you that, and so you don't need more.
So what you're saying is calories don't shut off the hunger drive. Nutrients do. Nutrients and fiber, nutrients.
So, there's a lot of things on hunger drive, and so the best way to get information on that is Dr. Greger's How Not to Diet book. And even on that app I showed you, he has 21 tweaks. So he talks about it's the stomach stretch from the bulk. It's the nutrients. There's a lot of reasons that shut off us wanting to eat. So that's a really good book for figuring that out. But you're doing perfect. Keep what you're doing.
Awesome.
Great. We have one more question. Okay. Let me put Dr. Kim on the screen and show.
Yes.
Okay.
Perfect.
Tiffany.
Okay, so Tiffany has a question of, some doctors believe the fat you eat is the fat you wear. Yes and no.
Okay.
Absolutely. That if you're eating too much fat, and if it's the wrong kind of fat, like saturated fats and trans fats, things like that, the fat you eat is the fat you wear. Now, I don't like counting calories. I don't like counting how much fat I have versus how much protein versus how much carbohydrates. You do that for some people if they need it in special reasons. But if you look at a piece of vegetable, it has the exact amount of fat versus protein versus carbohydrates you need. And there's fat in every single thing. A piece of lettuce has fat, but it's very teeny. And you do need some fat to absorb those fat soluble vitamins like A, D, E, and K. If you have zero fat, you're not going to live. So it's not that I don't want you to have no fat, but if you have only 10% of your calories from fat, that's perfect. That decreases the amount of insulin resistance, the fat that you eat, the fat you wear, things like that. So, don't pay attention to that. It's in everything. If you eat a vegetable, it has some fat in it, but the right amount. If you eat a fruit, it has some fat in it. Now, you want to avoid, if you're overweight or if you have diabetes, you want to avoid too much nuts and like avocados, which are higher fat foods. But there's some thin people who eat plant-based who need more fats to get the fat on them so they don't lose too much. Like when I started doing this, I lost 50 pounds. And all of a sudden, the first time in 47 years, I had to actually eat more to not lose too much because I exercise a lot.
Yeah.
And so I didn't look at like, oh my God, how much fat am I eating? I just added a little bit of the more high calorie dense foods, like a little bit more nuts and seeds, a little bit more avocados, a little bit more of the heavier grains. And it worked. And it just still has the right proportion.
Right.
So certainly if you only eat mindlessly nuts every day, first of all, you're not getting the variety of phytonutrients and vitamins and things that you need. So never eat just one thing. And certainly don't eat the saturated fat, the trans fats, which are dangerous for you, that you eat is the fat you wear. So if and the way they say that is because fat goes straight into fat. When you eat carbohydrates, it's processed, and then if you eat too much, it'll go into fat. But it takes a lot of energy to do that. Fat going to fat goes really easily. And so, you don't want to be too dogmatic. You just want to eat healthy. I hope that answers your question.
That's good.
I love it.
That was perfect. That was perfect, Dr. Kim. Wait a minute. Ooh, I'm hitting all the wrong buttons here. Jesus Lord. We're going to get it. But that is so true. And I think sometimes we can make it too difficult when we get into, counting the protein and the carbs and all. I've always in my journey just ate from the earth. I'm like, did it come from the earth? Is it processed? Is it any added oils, any added sugars, and just try to make sure it was as whole as possible.
Right.
And I don't get into I call it the drama of counting all this stuff and becoming a mathematician. You know what I say, Dr. Kim? I didn't worry about that when I was standing at the line at McDonald's. I didn't worry about the protein, the fats, the carbs. All I know is that it looked good, it tastes good, it was cheap, right? And it was, so I'm like, why? I don't understand why some people make it difficult. And now all of a sudden you want to become a biochemist because you're trying to become healthy, and it can freeze us into doing nothing because there's so much information out there that could just freeze you into doing nothing. Just you know what I'm saying? And so I truly try to keep it simple. And I think the most scientific I've gotten in this journey is understanding calorie density, and that'll be a whole nother talk, but that was good to know.
Yeah, and then that's what's talking when Tiffany was asking about the fat you eat, the fat you wear. If you eat a tablespoon of olive oil, that's 120 calories of pure fat that gets absorbed, and that goes straight to your hips. From your lips to your hips.
Yeah.
But if you eat an olive, you've got a little bit of fat in there that's hooked up to the fiber, which is going to be pooped out.
Yeah.
So you've got, it's the same thing with avocado versus avocado oil.
Right.
You don't want to, you don't want to have pure fats, as you said, the processed fats. You don't want to have that. You want to have the whole food as much as possible.
Yes, most definitely. This is awesome, Dr. Kim. And you know what? We try to be mindful of your time and everyone else's time. And this has been an amazing, empowering topic. And we thank you for just giving us some insight on how to use nutrition for recovery. Now, one thing you didn't say, and I'm pretty sure you said it, but maybe I didn't hear it, that I think the best part of using nutrition for recovery is that we don't have any side effects.
Yes, that's absolutely right.
Except
for good ones.
Exactly. They're all good, just all good side effects. And so that's what, and I'm not knocking medicine. There's time when we do have to take pills for acute care and all that. But for long-term care, I think I would rather choose nutrition, whole plant-based foods over pills any day. So we appreciate you, Dr. Kim. Again, I'm going to put your contact information up here. Y'all, please reach out to Dr. We're going to come off the screen, Dr. Kim. If you can go over your info one more time. Hold on one second.
Hey, my name is Dr. Kim Scheuer. You can reach me at plantbasedtelehealth.com or docslifestylemedicine.com or .net, sorry, at comcast.net. And don't forget to watch these guys at the upcoming event, which I hope they'll post again too, because it's going to be amazing. Yay, the Truth About Weight Loss Summit. I can't wait to see it.
Oh, Dr. Kim,
so with that being said, we appreciate you. Hold on one second. We appreciate each and every one of you for joining us. Again, in the description below, you'll find a link. Get registered for the upcoming event. That's coming up. The Real Truth About Weight. Well, I'm adding an extra adjective, but the truth about weight loss summit. You don't want to miss it. February 12th. Get registered. And with that being said, we're going to wish everyone a happy, healthy rest of the week. Join us on this coming Saturday. We'll be live working out. We thank you, Dr. Kim, for joining us. And
thank you.
And look, Get to the Root family. Dr. Kim has committed to coming and sharing one Wednesday a month with us to empower us. So we will be seeing her again next month, and I'll be letting you all know what her topic is going to be.
So let me know what topic you guys want.
I was just going to say that, Dr. Kim.
Say that again, Dr. Kim.
You guys let me know what topics you want. I'd rather talk about what you guys want, or I could do a question and answer, whatever you guys want. Let me know.
Yes. So you've heard.
And I'd love to go backpacking with Karen.
Oh, yeah. She did say she wanted to go backpacking. Look at that.
Wait a minute. Let me hide this here. Wait a minute. Let me get it right, Dr. Kim. But she said, where's Karen at? I want to go backpacking with you. I know that's right. I know that's right.
Yeah.
So
they said you're a beast at, Dr. Kim.
I love it.
I know that's right. So we appreciate each and every one of you again for joining us. And y'all know what we say here, Get to the Root, right?
That's right.
Our healthy choices.
That's right.
Becomes our healthy habits. And our healthy habits becomes and creates our healthy lifestyle that you are worthy of having.
That's right.
You're worthy. Tell yourself, I'm worthy of living a healthy lifestyle.
That's right.
So let's get to the root of obtaining and sustaining it by eating more plants.
That's right.
Moving our bodies.
That's right.
Stressing less. And loving more. Until next time, y'all take care.
All right.